Device Nation behind the booth at the end of the world over here, right? But that's where some of the cool products are. With Assort Health, Manning Edson. Welcome to San Diego.
Thanks for having me on your show.
I'm excited. So I went up to a surgeon recently and I said, what's the coolest thing that you've seen on the floor? He brings out a brochure with this company on it. Tell us what you guys are doing.
So we're here at AAOS right now speaking with surgeons about increasing patient access. So there's been a huge gap in the patient access market with patient calls. Patients in healthcare love to call you about any and everything. So we're able to use conversational AI to manage around 50-60% of your calls end-to-end, directly updating your patient schedules in your EMR. So Epic, Athena, ModMed, NextGen, currently working through all the implementations. So we're in over 100 orthopedic sites, managing around 50-60% of their calls without human intervention. And then some other workflows on top of that, which may be medication refill. Who am I seeing? Who should I see? Can I get directions for this? Can you text me this form? So just trying to help automate a lot of these processes that are really expensive currently.
Conversational AI has just gotten crazy lately.
Exactly.
I was telling you a story. I had a conversation with a company in Atlanta, and it wasn't until 20 minutes in that I asked some oddball question that I realized it was AI. I thought I was talking to a person the entire time. It's amazing, isn't it?
It's truly amazing how far the voice AI space has come along in the past few years, especially with the large language models that we're now able to use that are increasingly better. You can see really great latency in conversation now. We always do inform the patient that they're speaking with a virtual agent just to keep the patient trust. But we actually had a blind study done at an orthopedic group out of Maryland. They did a study behind our back to see how patients were liking it, and patients rated us 4.6 out of 5.
Wow.
So patients are really excited about not waiting on hold. That group is Peninsula Orthopedics. They used to have patients driving in to schedule appointments, and now their wait times have been cut by 90% by using AI to handle their majority of their workflows.
So Manning, for people watching this thinking, this might be cool for our practice to look into this as an adjunct to how we interact with our patients, how do they learn more?
So if you can't staff your call center, you're constantly struggling, it's just a day in, day out issue for your patients to access you, please find us on LinkedIn. More than happy to connect for a brief conversation, build out a demo, share your team, some case studies. We're seeing 3% net increase of patients year over year at some clinics. So find us on LinkedIn, more than happy to connect.
I'm glad I found y'all. I wish you guys great success here in San Diego.
Thank you so much, Kevin.